Michael Cohen, 1320 WILS. So there's some breakthrough stuff happening in the medical world when it comes to doctors treating you. People are concerned about what Obamacare is going to bring, but if you have the money, you can actually get some of the best medical service you've ever gotten. Concierge medicine. Someone who knows a lot about this is Dr. James Pinkney. He's with Diamond Physicians, diamondphysicians.com. Dr. James, thank you for joining us.
Oh, thanks for having me on the show.
Yeah, this is really something because would you say you're one of the pioneers in concierge medicine?
Well, concierge has been around for 30 years. It started in the 80s. But what I am pioneering is something called direct medicine or affordable concierge. So we actually charge a monthly membership fee for unlimited visits, no copay, and 24-hour access to your physician.
Like, how much does that cost to get that kind of service?
$45 a month for kids, and adults range from $95 to $295. So a couple $100 locks you in and guarantees that you're going to have access to your physician on your terms. So I pay my lawyer $300 an hour, and I'm talking about an entire month of unlimited visits that you can come in at Diamond and see your physician.
And what is the typical cost for this kind of concierge service?
It ranges anywhere from, we've got people out there charging $10 a month for kids, all the way up to $2,000 to $3,000 a year for direct medicine. And then, of course, concierge medicine, the sky's the limit. There's doctors around the country that are charging $100,000 per month. But the new trends are direct medicine, and a couple $100 is on average what direct medicine doctors are charging.
Now, you still need insurance, though, to have the service, do you?
You do not have to have insurance. We recommend everyone have at least a catastrophic plan. That way, if you do have a motor vehicle accident or need surgery or need some type of cancer treatment, you are covered. But we really want to encourage people to use their health insurance like we use our car insurance or home insurance. When you're driving along and you need fuel in your vehicle, you pay for your gas out of pocket. You pay for your windshield wipers, your tires, your oil change out of pocket. You don't put a claim with your insurance.
It's more for the big incidents. Now, you're saying that instead of going to a doctor and paying a couple $100 to see them for 20 minutes, you can just hop in and have yourself checked out or ask a question at just that monthly fee?
That's exactly right. And that monthly fee is for the entire month. So
how's business going? Is it booming?
Business is booming. Clients are absolutely loving the service. We're signing up more families every day. We actually are franchised, so we've got franchise interest from all over the country, and we may be opening our first franchise here in the next few weeks to a month or so.
Are you going to be opening up something in Michigan at some point? Or?
I haven't had any specific interest from Michigan. We've had interest from Chicago, but if there's investors out there or physicians that are interested, they can go to diamondphysicians.com and contact me at franchise at Diamond Physicians, and I'd love to chat with them. Our whole goal is to provide affordable health care to every U.S. citizen.
Well, it sounds like a great deal for the patient, certainly, but what about as a doctor? Are you not overwhelmed with patients coming in?
Not at all. We actually limit each physician to 500 clients. And the average family medicine physician is going to see anywhere from 4,000 to 5,000 clients, patients in their census to keep the doors open. So there's a 90% reduction in the amount of patients that a concierge doctor sees, and that allows us to dedicate more time, more individualized care to each client.
Well, it makes you wonder, I mean, so what's happening in our traditional medical system where you can operate so efficiently and on the other side it's so expensive and burdensome somehow?
Well, we cut out the middleman. We cut out the insurance payers. So we've negotiated rates, cash pay rates with small vendors, in our case, around Dallas. So traditionally, an MRI will cost you around $5,000 out of pocket. Well, I've negotiated rates, and we can get a cash pay price at $350. So that's over a 90% reduction, and we pass those savings directly on to our clients.
That's crazy. So we're getting completely ripped off when we go to MRIs, that kind of thing? What's happening here?
You're getting charged 1,000, 2,000% more than you should. Unfortunately, we live in a capitalistic society, and everything's been monetized. So what we try to do is we try to have some fiscal responsibility with our profit margins, and we charge people a reasonable cost. And our monthly membership fee keeps the doors open, keeps the lights on, and then everything else, we just charge our cost, and that's how we're going to lower the cost of healthcare globally. The same thing with labs. If you go to a big-name lab and you don't have insurance, and let's say you just need a cholesterol check, you're going to pay $127. Well, we charge $6 for that cholesterol check.
That is absolutely insane. So Are people getting wind of this, do you think, nationwide, or is it still in its early stages?
People are starting to get the gist and understand that there are better ways out there. There's a better way to obtain health care, and it's cost-effective. So our whole mantra is better care at a better price.
Do you get any pushback from the traditional medical system when they see what you're doing and how you're undercutting them this way?
Not yet. I'm sure when concierge direct medicine becomes large enough, we will, because we're exposing all the insurance payers that are charging way too much money. I read an article just the other day that a man up in New Jersey cut his finger, went to the hospital, didn't require stitches. They put some ointment on his finger and a Band-Aid and charged him $9,000.
So that's amazing. You're available 24/7, is that right?
24 hours a day.
So who's the doctor that's up at 4 or 3 in the morning to deal with patients?
I am. If someone calls me, I come up to the office and meet them.
Really?
Now, the beauty of our system is we're always on top of things. So very rarely does an emergency or an urgency occur at 3 or 4 in the morning. Our physicians, our clients have our email address. They have our cell phone number. So we're in constant contact. Mm-hmm. So we very rarely get surprised. Now, it does happen, but it's few and far between.
It sounds fantastic, and probably just a matter of time before, you'll get some kind of reaction from the traditional medical community, because this is almost too good to be true. Do people say that to you?
All the time. Yeah. And the truth of the matter is, the traditional insurance model is so catastrophic and so riddled with inefficiencies that we've streamlined everything by simplifying things. You pay out of pocket for your everyday medical expenses. It's very simple, and that's how we keep costs down. Insurance should be for emergencies, not urgencies. But everyone uses insurance for day-to-day
everything.
urgencies.
Yep, and for them, it's they win every time people do that, I'm guessing.
Right.
Dr. James Pinkney, the website is diamondphysicians.com, diamondphysicians.com, concierge medicine. Beautiful stuff. Dr. Pinkney, thank you very much, Dr. James.
Thanks for having me on the show.
Yep, Michael Cohen, producer Solomon Martin. This is 1320 WILS.